big podcast where we feature African entrepreneurs across the United States and also other parts of the world who are doing amazing things. So tell us, who is Rose? Give us some background about yourself.
Rose is a lady. Rose is an entrepreneur. Rose is a philanthropist. Rose is a nurse by profession. And Rose actually is a mindset coach. When I say a mindset coach, basically is the fact that we do a transformational approach that enable individuals realize their potential. So basically, in brief, that's Rose Oginga.
Oh, that's amazing work that you do. I've read quite a number of books about mindset, and it's definitely a growing industry, so to speak. How has the uptake of your services been in the United States so far?
That's a great question. And it's very wide, I must say. Um, it all depends on the audience that I get. And I work with youth and women, so that gives me a wider perspective. I always tell individuals that when you meet a woman, you've met the family because
Yeah.
that person expresses exactly what a family ought to be. It doesn't matter what kind of family setup it is, but a woman carries all. And added to the children and youth, that's now a whole family because it will definitely affect, effect, and embrace the man. So the man
Mhm.
in there, regardless of not being mentioned, because they reflect the man.
Yeah, that is so true, especially coming from an African context. That is something we can relate to. So, our mothers going through that. I think right now, as a wife, as a mother, I can really relate to what you're saying. So, what inspired you to come up with I Hope as an organization?
Awesome. Growing up as a young girl, it was not very easy for me. I had issues with health as I was growing up. I had anemic. I was anemic, and we didn't know exactly what it was because mom would take me to the hospital every now and then. Nothing used to happen. And while, as much as I was born and raised in Nairobi, partly, I ended up staying with my mom in the village, and getting to the hospital was crazy. We would use a wheelbarrow to be taken to the hospital. And out of that, it would take like almost a 3 hour, journey to the hospital. That if there was means, it's less than 10 minutes to the hospital. So this occurrence really, as I grew up, was so much hard hit on me. And then also the fact that when I was growing up as well, my father had 12 children, so it was not easy for him as much as most Africans, can relate to. Uh, Tuition or school fees was such a difficult thing. But my mom was such an entrepreneur, was always like, whatever it is, let me get that money that you're giving your daughter, I will make it well. So she would buy cereal, sell the cereal, get her money for the upkeep, and then send the rest for school fees. So individuals help me as much as they help dad for me to complete my high school. So that's the story about why this I Hope came. The term I Hope has a middle name or a middle wording, HOPE, hope for education, hope for empowerment, a hope for something good. However, it's an acronym that states International Health Operation Patient Education and Empowerment. So we are driven by hope. The hope that my mom had that if she could sell some cereal, she'd be able to make money for the whole family and also set up my school tuition, and accepted dad's offer that was there. So that's how I Hope was born, and it was born by 8 individuals whom we met with on Facebook. As
Oh,
people say, Facebook is bad. It depends on your intention. Many intentions that are good end up doing good jobs. However, be cautious while there, I must say.
Yeah, it's amazing. Tell us more about that story. How did you approach these people on Facebook? Because I'm sure there are quite a number of people who want to come up with certain initiatives, but they don't know, how do I start approaching people? What avenues are there? How did you start?
That's a good question. Basically, when I started off this, or we were on Facebook, and individuals saw what I was doing, we started off with, first of all, we started off with two. One great friend of mine who currently is in Seattle, and we were both teachers, by the way. While I was in Kenya, I taught for 15 years in Kenya, both middle school and high school. And she was like, it is high time we do something about the children. And how do we start this? So we got together and started the book initiative, a library book. And
Mm-hmm.
then we also did the uniform book, a drive. And when people notice this, they're like, Rose, I've been following you, but I'm interested in what you're doing. I like the fact that you're approaching it in a different way. So the communication was very easy because they saw what was happening and they were interested. So they came in with that passion and interest and had very one intention to do good for the community back home. So that's how the approach was so easy and well defined.
Yeah, I think I like the fact that you're able to leverage social media to showcase and also drive some level of accountability. Because a lot of times when we hear of, nonprofits, the first question that comes to our minds as Africans, is the trust barriers that we usually have. But by you showcasing what you've been able to do, that you already have the ball rolling, then it's a lot easier for you to get, access to support and people who are willing to join you in that journey.
Mhm.
Yeah. So I know, you've talked about Kenya quite a lot. You've talked about the US. Tell us more about, these projects that you do. Who is the main beneficiary and where are they?
Very, very good question. As I said, I hope is an international health operation, patient education, and economic empowerment. We basically handle these cases both in the US and also in Kenya. In Kenya is not one particular area at the moment. We
Mhm,
try to get involved with our friends who are in the US, who have families in various communities in Kenya, and hence we get involved globally. I state this with a lot of confidence for what I saw during the 2020 pandemic, when I needed to approach the global aspects of how to help the young people engage in a better life situation and protect themselves reproductive health wise. So
mhm,
I just want to give an instance to explain this. When that did happen in 2020, students were locked down, or there was school lockdown, so they had to go back to their parents. And unfortunately, within those circumstances, some of the individuals' relatives were not as faithful as they appeared to be. They did go ahead and some were molested. Unfortunately, some got pregnant, some got sick because of that period of time. And what did Rose and the team do? Remember, I'm not alone in this journey. We engaged individuals here in America, different groups of friends. A team of go givers came up and donated their funds and raised funds to help in the situation. We were so lucky that even the government kind of was helpful, since the fact that we could not even meet 200 of us in a small situation because there was control. So a company, Rivertex, was kind enough and offered masks. We went to over 27 regions with the help of the communities who are in the US. They directed us on who to go to and where to and who to coordinate that. In Kenya, there is over 200 of us who are volunteering at any one time or another. In other words, if there is an activity, a project that is on progress, we are able to support, they come through, and they go to those instances. So we don't have a specific. We go to where there is need, and that's what we support.
Oh, that's great to know that you're capturing, both sides. And are you just focusing on Kenya, or do you also have initiatives in other parts of Africa?
At the moment, we do not have initiative in other parts of Africa.
Mm-hmm.
However, we have a global healthcare awareness that we do
Mm-hmm.
oftenly, and mostly it's about a month each, and it is done virtually via Zoom. So we do get experts who are able to tell us more on areas not necessarily limited to healthcare, though that's our main focus. But we realize that people need to know about their future, about the investment, about what need to be done for them to be stable in life. One thing
Mm-hmm.
me and my friends or my team agree on is that you cannot give a human being fish forever. There comes a time you have to give them a rod for them to get up and do it and feed others.
Mm-hmm.
So as we leave a legacy of giving, we also believe that those would be our ambassadors to give the next generation.
Yeah, that is on point. So you just talked about Zoom and how, through Zoom, we've been able to reach wider audiences and have conversations despite the physical distances. In your nonprofit, give me a use case where you deploy technology either to monitor the projects that you have on the ground or make sure that resources, go to the projects that they're supposed to go to.
Great. I'm not an IT guy.
Yeah.
But I'm fortunate enough to have team members who are very knowledgeable in IT, and they very, very handy. We use a lot of the eDoc to actually find out what has been done, where has the funds gone to, who has been seen, and all that. And our website also captures that monies that go in, come in, and it's safe and well monitored. Again, I hope has been established since 2017. So we've been in the journey for a while officially. Is a tax
Mhm.
exempt. So basically, we have to report all that we do. This enables us to be very on top of everything that we are doing. So Google is our friend. Google Doc and was our website guy who is steady, and ours is to report this is happening. What do we do? And so far, so good.
Yeah. Um, Tell us about some of the obstacles that you have faced in growing, I hope, and all the other businesses in general that you do run as an entrepreneur.
Verily, verily. That's a very loaded question. In any aspect of business, there is always the pros and cons. There's always the tendency of what next. Mostly, I must say, the needs are huge. The finances are limited. And majority of our community are learning what it means to volunteer. All our team members are volunteer, but they need money to make things happen. So I must say the bigger hurdle is the finances. Resources in terms of human resource is available. But for example, we have 15 young people in college, in vocational, that is polytechnics, and then we have the high schoolers. So total of 15 people that we do partial and full scholarship.
All
So
in Kenya?
yes, all in Kenya right now. This can only be done if we get support from our good friends and good companies that are following us. And we've been lucky, a few of the companies have been able to pick up, for example, one of the Rotary Club enabled us to do the desk projects. So over 70 desks were given to different schools. So the major challenge is not human resource, it's the finances to make these programs a success. How
Mm-hmm.
do we do this? We've been able to do this by creating awareness, forming galas, and talking to individuals and talking to companies. And we
Mm-hmm.
are looking for good marketeers like my friend here. How do we do it to help meet as many people as we can?
Mm-hmm.
And Aisha, I believe this is going to be your gig there.
Yeah, yeah, sure. So, Rose, for the listeners out there who maybe would want to support you in terms of maybe fundraising or any kind of support, how do they contact you?
We do have a website, as I said earlier, that is very well safe, I must say, because it's been running for the last 7, 8, 9 years. We are 9 years old now. It's safe. It's www.ihopee.org. How you pronounce it does not matter. What matters is get IHOPE. IHopee, IHopee, all.
Yeah.
Please go there and donate. We have itemized aspects. Whatever you feel you can do will be great. We are very much holistic approach and evidence based. And we believe that you can give your support in various ways. You can support us by taking students or adopting one, adopt a school, or whatever you are very much comfortable with. It will go a long way.
Okay, great. So, Rose, in terms of impact, just give us a summary of, how many lives you've been able to impact so far. How does the future of iHope look like in your lens?
In my lens, it's so huge. In many lenses, maybe it's narrow. I don't know. It depends on who is watching us. I hope has been fortunate enough. 2014 was able to send books that was able to attract over 27 local schools. 10,000 books were sent from here in the US to the
Mhm.
different schools. So we have touched and continually touch as many students who get involved in those library sessions. And most of these books, we intended them to go to schools that have never had libraries. So we believe if they didn't use them for firewood, it is helping at least the English teachers to do something better. And we
Mhm.
do understand the difference in accent and the difference in, the way the American English is and the British English is, for instance. But
Mhm.
still, it's enabling people have that curiosity, or young people getting that curiosity, both high school and middle school, for example, to get engaged and start getting to read the books. That is one. Number two, we were able to impact 20,000 young people in 2020. That was during the pandemic, which we were able to do the reproductive health and telling the young girls and boys that there is an answer, NO, which means no, do not allow people to, step on you. And I, being fortunate enough to be a human rights advocacy awardee, I'm confident that if we tell people what their rights are, they will definitely know what to do, when, and how. I was very fortunate to have that opportunity to be awarded that certificate. In 20 in over the years, online, as I said, we are not restricted. So we are able to bring in as many people as possible. We've had a chance to talk to over 15 individuals who are expert in their own uh, part of work. And they've been able, the ones that we have seen through our data, about 5,000. So that is just working online, those who come through our data. But when we talk of Facebook, there are so many people who come in and out to watch that. But I'm talking about the Zoom aspect where people come in and, you talk to them and encourage them on investment, for example, or talk about the data analytics or tech issues. So they're able to come in and make final decision. Whatever they do with the information, we hope it's for the good. So
Yeah.
the feedback that we get is very positive because we get repeat speakers. This enables us to realize that, okay, we are reaching out somewhere.
Yeah.
We've also covered about three regions to be exact. No, four right now for medical mission that we do yearly. So medical mission has been our backbone in terms of the fact that we reach individuals who are not able to get medication for themselves, and training or teaching or just treatment for that matter. And individuals from the US who are health professionals, they collaborate with the individuals in Kenya, for example. At the moment, we are working with Kenyan community. So the individuals there help us work together and do things. We did this in Bondo, we did this in Kisumu, and we did this in Nairobi, Kayole area. This
Mm-hmm.
year alone, 2023, we collaborated, and that's why I was encouraging individuals who are ready to work with us that, hey, come on, let's join hands together. That is our motto in Kenya, Harambe Pamoja. So come, let's join together and let's do something significantly. I want to give a shout out to one very major individual and his company, Optiven. So George Washuru was
Mm-hmm.
one individual this year, 2023, who came through for us. As I said, finances are a bit difficult. Getting those individuals to contribute can be hard, but he was able to work with us, and we went to Bondo and offered food distribution. So this is how we collaborated. He was able to do the food distribution, whereas we did our very strongest part, which is healthcare. So we created healthcare awareness. Over about 4,000 people were fed, about 3,500 were treated. So that
Wow.
situation tells me that there's more we can do as a team. Hence, our motto is building partnership together. You become my partner, we work on what is positive, and we create an impact that lasts for a long, long time. The medical mission was not done by IHOPE alone. There are so many other small nonprofits that are doing great things that came through for IHOPE while their leaders, majority, were still in the US. So we didn't have to drive all the way or fly all the way. We worked with a group that intentions were to create a difference in the community.
Mm-hmm. Mm-hmm.
The major one that I must mention in that context is called Sagam Foundation. And also we had the Hayes who work with the Kenya medical students, the Maseno medical students, and they were all there to do what they do and what they love best. One of our pharmacists came from all the way Eldoret to do the same
Mm-hmm.
because we need some expertise that any other person cannot do. And this
Yeah.
was a success that we still marvel. April 2023.
Yeah, partnerships are always a good way to come together. It makes things move faster and, you get to have more synergies. For that kid who needs your help out there, do they reach you through the website? How does that kid in that village who requires support get access to some of these services?
Great, great point. Again, we have a very good website, as I said. You only need to email us info@ihope.org. And if you don't, there is always a telephone number there that you can feel free and text anytime, text away, and you will get the team who will respond to you. We offer free life coaching because we realize that personal development is key. Some of us are here because somebody held our hands to
Yeah.
be. So we are holding hands, we are engaging individuals who are able to support us through their expertise. So it's just an email away or a text away, get through to us.
Yeah. As we wrap up, any nuggets you'd like to share maybe with other philanthropists or other African entrepreneurs listening to you right now? Maybe they're scared to dive in, they don't know how to start.
Are you
Any
trying to steal some of my tricks?
No, I just want you to encourage someone out there who is looking at you right now and saying, it's easier said than done.
Absolutely, absolutely. The key thing that we must realize that you have to be able to offer a service for you to get a customer. There's no way you get a customer before you offer your services. So
Mhm.
let's learn to offer services freely before we get them engaged financially. So
Mhm.
our service have been most of them free, and we believe it's creating a lot of impact. And of course, when you need more, there is need for you to go to the next level. And it is a mutual agreement. So please, as you enter the entrepreneurial world, it's not piece of cake. It's not all milk and honey, but it is a commitment. And working with women and youth has taught me one thing: understand their pain. If you understand their pain, you reach their heart. If you reach their heart, you probably might reach their pocket.
I like that, Rose. I like that so much. Thank you so much.